everyone. Thanks so much for joining us. My name is Lisa Mumper, and I'm a financial advisor in the Brookfield location of Wealth Distribution Strategies. At WDS, our mission is to help our clients achieve their financial, family, health, charitable, and social aspirations one conversation at a time. Today, we'll be discussing Medicare with WDS Health Medicare Specialist Ben Rothering. Want to touch quickly on our next three upcoming events. Thursday, August 22nd, we are doing a tax planning webinar with Luke Wendt, our tax advisor. Tuesday, September 19th, we're doing a webinar on the circadian rhythm, and I'll show you how that influences different things from a health perspective. And then October, one of our favorite events, pumpkin contest. So during the month of October, you can submit a photo of your family's best pumpkin for a chance to win prizes. You can expect our speaker today to have the floor for about 45 minutes, and we'll conduct a short Q&A at the end of the webinar. This webinar will be recorded. A short recap version and a full version will be available to clients within 2 weeks. If you have any questions during the webinar, please type them into the chat window. We'll address them during the Q&A. Any questions submitted during the registration will also be addressed at that time. Without further ado, I'll hand it over to Ben Rothering.
Great, thank you, Lisa. Welcome, everybody. I appreciate you all spending a little time with us this evening, and hopefully we will get you out of here in a reasonable time and get most of your questions or all of your questions answered to the best of our ability. So at any point in time, if you want to take down my information, beyond the seminar, feel free to reach out to me, and I'm happy to help along the way. So just to get going, what I do on a daily basis is helping people with their health and their life. Under the scope of health, of course, talking about Medicare supplements, Medicare Advantage plans. We talk about Part D, which is prescription drug coverage as well. A lot of people that are coming off of their group insurance, they want to be able to continue their dental, their vision coverage. So we can talk about that, extended cancer protection as well. We also discuss a little bit of life insurance. So if you need, whether it's just for final expenses, some term, if you still have a little bit of debt that needs to be taken care of, whole life and juvenile life as well. And you can see my crew there in the picture. So today, the things that we're going to talk about, a little bit about Social Security and Medicare and kind of how they get intermingled. Medicare, your eligibility, how do you enroll? We're going to talk about your different enrollment periods. If you decide to retire early, or if you work beyond 65, what do we do? What are your options? What if there's a spouse in the mix? What do we do about coverage for them? And what we call the alphabet soup of Medicare, the 4 different parts of Medicare, and all your different options beyond. So to start, very basic, what is Medicare? It's a federally funded program for anybody who is getting ready to turn 65 or beyond 65. It can be for people who are under the age of 65 if they qualify due to certain medical disabilities or chronic kidney failure or anything like that. Not to be confused with Medicaid, which is federally and state funded, going to be more for people who have limited resources. So Medicare itself was started in 1965, run by CMS, which is Center for Medicare and Medicaid Services. Again, typically for seniors, and over the years, they've tried to enhance Medicare and what it offers by adding drug coverage and enhancing their preventive care benefits as well. And there are a number of different reference materials out there, whether it's the Medicare and You booklet, I think is sent directly out to you, and there's also how to choose a Medigap policy book as well. So first, talking about Social Security and signing up for Medicare and everything. You're all on this, so you have some capabilities of online knowledge, so that's great. If you have an online account with Social Security at ssa.gov, that's great. That can make enrolling a lot easier. If you don't, it's easy enough to create that account at the Social Security website. It can just eliminate you having to go down to the office or set up a phone interview that might be a couple months away. Enrolling in Medicare online, once you have that account, it takes about 5 to 10 minutes to do. So pretty easy. Definitely get that account. If you need any help, certainly let me know, and I'm always happy to help. Okay. Where people get Medicare and Social Security confused, Social Security and taking your Social Security benefit, you can do that whenever you decide, whenever you and your financial advisor feel that it's the best time for you to do that. Taking your Medicare benefits, your health insurance, is whenever you retire and turn 65 or beyond, right? The confusion comes in is that we have to go through Social Security in order to enroll in Medicare, okay? So signing up, now as we go through, I'm going to reference really two different groups here, okay? So one group is the group of people who are not yet receiving their Social Security benefits, okay? The other group is a group of people who are receiving Social Security, okay? So what that means is if you are approaching age 65 and if you do not have your Social Security benefits and you plan on going on to Medicare, you have to do that enrollment, okay? But if you are already receiving Social Security, the government knows you're turning 65, believe it or not. So about 3 months ahead of your birth month, they're going to send you your Medicare card with A and B on it. And it's your choice to determine whether or not you want to keep those or if you have other situations going on, which we'll discuss as we go here. But Medicare Part A, for most people, if you or a spouse have worked long enough, your 40 quarters, your 10 years, and FICA's been taking money out of your paychecks, then Part A should be premium free for you. You shouldn't have to worry about any, any potential penalties or anything like that. So everybody is going to fall into one of these three different enrollment periods. So the initial enrollment period is when you are approaching age 65. It's a 7-month window that starts 3 months ahead of time. It includes your birth month and goes 3 months after. If you are planning on going on Medicare when you turn 65, I highly recommend taking advantage of the 3 months ahead of time. It will make your life easier and make sure that kind of all your ducks are in a row and everything starts when it needs to, okay? And Medicare is going to begin always on the first day of a month. So typically if you're turning 65 and you take Medicare, it'll start on the first day of your birth month, no matter what day of the month you were born, anywhere from the 2nd to the 31st. Now, if you were born on the first day of a month, then you can actually start Medicare a month ahead of time. Okay, so that's important to know because that will shift your 7-month window a little bit. I'm going to skip number 2 for just a moment. I'm going to jump to number 3 because most people either fall in the initial enrollment period or the special enrollment period. So the special enrollment period is for anyone who decided to work beyond 65 and you still have group insurance, whether it's through your own employment or a spouse's employment. And when that employment is going to end, retirement comes, then you have this special enrollment period where you can go pick up Medicare and all the other things that you need without getting penalized for doing it at a later date. Okay. That is called a qualifying event. And now that the special enrollment period is a 63-day window. It's not a 7-month long window. It's 63 days from the day you lose coverage. Now, with that being said, we can start the process roughly about 3 months ahead of time to get everything set up so that when your group insurance ends, then your Medicare and all your other options begin. So where do penalties come in? Penalties are going to come in the general enrollment period. So this is for someone who turned 65, did not enroll in Medicare, and doesn't have group insurance or any other group or health insurance to speak of. And let's say they just roll with that for a year or two. And now they're thinking, well, I'm getting a little older. Maybe I should pick up Medicare. Well, now they are going to be a part of the general enrollment period. So they have to wait until the next January to enroll. and then Medicare will begin on the first day of the next month. But now that is when that penalty is going to come in. So you're going to get a 10% penalty per year that you delayed your enrollment without proof of any other prior creditable coverage. So hopefully nobody falls into group number 2 in the general enrollment period. Hopefully everybody is utilizing either the initial or the special enrollment periods. Now, Part B, as I mentioned, if you're not receiving Social Security, you have to do that enrollment. If you are at 65, then they're going to send you your card and you'll have A and B on that. Okay. Now, Part B does have a premium that it is going to carry with it. So how they determine your premium is based on how you filed your taxes from 2 years earlier. So right now they're looking at 2022 and where was your income, whether you filed individually or jointly, and then your premium is going to be in that bottom row based on where you fall. Okay. So if you find yourself in a higher bracket, you're going to have a little bit more towards Part B that you're paying. And there will also be an additional towards Part D. And that's something that we'll talk about individually. If you feel that the number they give you for a premium is higher than it should be, they're going to tell you. They're going to look at your taxes and look at those numbers. And if you disagree, there is an opportunity to appeal to try and get your premium down where you think it should be. All of these numbers, what's important to know is all of these numbers change. The premiums change every single year. So what can happen is, let's say you're in a higher bracket, but then as you retire, maybe your income goes down. They will look at that every single year, and your premiums for Part B could go down from those brackets to kind of fit where you are at that point in time. So the 4 different parts of Medicare, again, the alphabet soup that we talk about, A, B, C, and D. So A is all about your inpatient hospitalization. B is your outpatient medical. Part C is privatized Medicare. This is Medicare Advantage. And then Part D is prescription drug coverage. So we're going to talk about each of these individually. And as we go, we're going to slowly fill in parts of this healthcare pie to give you an idea of what is going to be covered, but where are there still gaps? And, do you have some of those gaps covered, or are those, things that we need to discuss and find some coverage for you? So let's talk about Part A first. So Part A, again, is all about your inpatient hospitalization. If you are admitted to the hospital, and I do stress the word admitted because there's a significant difference between admittance and observation. Okay, it doesn't mean you're not covered. It's who's covering it. Is it A? Is it B? So if you are admitted, that is going to kick in Part A. And it's going to initiate a benefit period of 60 days. Okay, so in those first 60 days, Medicare is going to cover everything after the Part A deductible has been paid. Okay, and you can see the Part A deductible for this year is that $1,632. Now, if you remain in the hospital beyond 60 days, now Medicare is going to cover everything but the $408 for the next 30 days. And if you go in beyond that, then they leave behind $816. Now, those 60 days, they're called lifetime reserve days, and they are one-time use days. So what that means is if you were in the hospital for 95 days consecutively, then you've used 5 of those lifetime reserve days, and you're down to 55 for the rest of your life. Okay. Now, what's really important about this slide here is that it works on a benefit period of 60 days. So what that means is that those 60 days could recur. So if you're admitted to the hospital and then you're discharged, and a couple months later, you get outside of 60 days and now you're admitted to the hospital again, then a whole new 60-day benefit period starts all over, and that Part A deductible needs to be paid again. Okay, so over the years, I've had clients ask me, if I have A and B, and A and B covers a significant portion, and they discount a lot of the services that are out there. Do I really need anything else? And the answer is, well, you don't have to. There's no rule saying that you have to go get a supplement or an advantage plan. But the problem is Medicare, it's an uncapped liability. So that tab is going to keep running if you keep having, medical issues and you're in and out of the hospital. So most people don't want to pay the Part A deductible, 2, 3, 4, 5 times over the course of the year. So to have something else there to give you that ceiling and give you that cap is very helpful. Okay. Now, to continue along with Part A benefits, if you know that upon being discharged from the hospital, that they're telling you you need to go into a rehab facility, right? To go into skilled nursing. We need to make sure that we are following Medicare's rules, because Medicare, they're the ones making the rules. So in order for Medicare to follow you to a skilled nursing facility, you have to have been admitted to the hospital for a minimum of 3, it says 3 days, it's 3 midnights, okay? And then be at a Medicare approved facility. So when you go on Medicare, you always want to make sure that wherever you go, that they accept and bill Medicare. That is number one, okay? Because if you go somewhere else, you are uninsured, and you're going to pay everything out of pocket. So we got to make sure you're always at a Medicare approved facility. But we always have to be making sure that we are following Medicare's rules as well. So the skilled nursing benefit here, this works on a 20-day benefit period. So as long as we're following Medicare's rules, then Medicare is going to pick up 100% of the first 20 days at a skilled nursing facility. And they leave a little bit behind for the next 80 days. Now, if you're in consecutively beyond 100 days, well, that's where you're going to come in. But again, those 20 days, it's a benefit period, so it can start over. And then finishing up with the Part A benefits, when we talk about blood work, we're talking like inpatient transfusions, okay? So Medicare, they won't pay the first 3 pints of blood each year, but they pick up everything after that. Home health, everything that is considered as medically necessary, then Medicare will pick that up. So you're going to hear that a lot. You're going to hear medically necessary, right? We can't go and do whatever we want, whenever we want, just because we feel like it. Your provider needs to be proving to Medicare that whatever they're recommending as a test or a procedure or a move from one place to another, that it is medically necessary for that to happen, to make sure that Medicare is on board. Okay. If they don't, then Medicare could deny it, and then you might be kind of out in the cold, right? So we want to make sure that Medicare is always going to be on board, and that your providers are proving that medical necessity. And then hospice for the terminally ill, this is a pretty amazing benefit. Any of the medical care that relates to a terminal diagnosis is really well taken care of here. The potential for any out-of-pocket would be if instead of staying at home and having a nurse coming to visit you and help and take care of you at home, if you are now a resident at a facility, there's potential that you would have to pay for the room and board or the rent to live at that facility, but the medical care is all part of this hospice benefit. So that rounds out the Part A benefits, and this is how it's going to look in that healthcare pie. So next up comes Part B. Now, Part B is all about your outpatient, right? So this is your regular doctoring, specialist visits, therapies, durable medical equipment, ambulance services. I will tell you one thing, kind of a pro tip. When you go on Medicare, if an ambulance is called for you, take the ride, okay? Because the ambulance company, they want to get paid. And if you don't get in and you shoo them away, then you're going to pay for that ambulance. If you want Medicare to jump on board, then get in, take the ride, give them your Medicare card, okay? Now, part of Part B is also talking about preventive services. So when you go on Part B for the first time, Medicare is going to pick up a welcome to Medicare visit. And then every year after that, they are going to pick up a wellness visit. So this is a check-in with your doctor to get back into the system if you haven't been, talking to them for a few years. It's not a full-on physical. It is, hey, how you doing? 20, 30 minutes, answer a handful of questions, and, you're in and you're out. Okay, but it's a way to just check back in. Some other preventive services that Medicare is going to cover, and these are just a few of them. There's a whole list of preventive services and how often Medicare says that they're going to cover it based on their frequency. So an abdominal aortic aneurysm screening, they're going to cover one in your lifetime. They'll pick up mammograms every year, blood tests every 5 years, colonoscopies every 10 years. Now, some of you might be saying, well, hold on, I had a colonoscopy and they found polyps, and my doctor says I need to come in every 5 years or every 3 years. So again, proving medical necessity. If your doctor deems you as a high-risk individual, then Medicare will approve and be on board for that every 5 years or every 3 years, assuming that your doctor is proving that, okay? They will also pick up flu shots every year. So again, let's pause. Pro tip: any vaccine you are looking to get, go to a pharmacy. Do not get it at the doctor's office. It will make your life a lot easier. Okay, because the doctor's office is only going to bill Part B, and then you have to go and submit a claim to your drug company. And then they might charge you for the administration of the shot. Now, if you go to a pharmacy, you're going to give them your Medicare card, so they bill B. You're going to give them your drug plan card, so they bill Part D, and they aren't going to charge you for the administration of the shot, at least not at this time, they don't. So it makes your life a lot easier. You're in, you're out, and it's done. Okay. Now, Part B works differently from Part A, right? Where Part A had that 60-day benefit period. Part B works on an annual deductible. So this year, the annual deductible is $240. So what that means is that when you have your first couple outpatient visits, before Medicare is going to jump in and pay their 80%, that Part B annual deductible needs to be paid. Okay, once that's done, now anything that Medicare is a part of, they pick up 80% and they leave 20% behind. Other Part B benefits are blood tests for clinical labs for diagnostic services. We talked a little bit about those preventive services, but nothing that exceeds the Medicare approved amount. So what does that mean? That means that if you run into a doctor that does not accept Medicare's assignment, okay, and you can see this definition in the guidebook that's put out by the Commissioner of Insurance in the state of Wisconsin. But accepting assignment means that a provider accepts Medicare's discounted rate. Okay, so Medicare has their idea of what they deem as an appropriate charge for any particular procedure. Basically, they chop it, they discount it heavily. And if the provider, if they accept assignment, then they forget about the excess and they just take the Medicare approved amount. So let me give you an example. Kind of unrealistic numbers, but we're going to make it simple. So if you go in and your total charge for that visit is $115, Medicare is going to look at it and say, well, we approve $100 of that $115. And if the provider, if they accept assignment, they say, forget the $15, we're going to take that $100. And now Medicare covers 80%, so they're $80 and there's $20 left behind. But if that doctor does not accept assignment, they can actually charge 15% more than the Medicare approved amount. So now we're back up at that 115, and the difference between the Medicare approved amount and the actual charge is called an excess charge, okay? And we can talk about that when we talk about individual products and all that kind of stuff, but that is something to be aware of. So always, one, making sure you're at a Medicare approved facility, but also knowing that your providers accept assignment. Okay, do they accept Medicare's discounted rate? What is Medicare not going to cover? Because Medicare A and B, that's original Medicare. So what is that? What are they not going to cover? They're not going to touch anything with routine dental, vision, hearing, foot care, nothing long-term care, anything that's alternative. If you like to go more of a kind of a holistic or homeopathic approach, you're on your own, right? Everything that Medicare is a part of has to have been put through the paces and approved. Nothing elective, personal care. Medicare is going to go all over the country. They will go to every single state, but they will not cross the border. Okay. Prescription drugs, we're going to talk about that. That's going to be a separate thing. And nothing non-medical. So examples of non-medical expenses, If you were to have a not so great diagnosis and you want to go get a second opinion, and let's say you find a specialist who's halfway across the country. Well, Medicare isn't going to help pay for your travel costs, your lodging to get there, right? If you're going through treatments and you want a wig, they aren't going to pay for the wig, okay? So this is how Part B is going to jump into that healthcare pie. So you'll notice there's still quite a few gaps in there that you might feel like you need to fill in. Maybe you already do. So now we've got Part C, which is Medicare Advantage. So when you go on Medicare, you really have two options. So one option would be to take A and B, original Medicare, and add a supplement or a Medigap plan and a drug plan. So A, B, a supplement, and a drug plan. Or another option would be to take all of that and kind of for ease to put it all into a ball and go with a Medicare Advantage plan. Okay, now it's a very simplified way of putting it, but we'll do a little bit of comparison here. Okay, so in order to go on to an Advantage plan, first you do have to enroll in original Medicare. And then when you sign up with a company offering an Advantage plan, you now, that company and that plan has now taken over. Okay, so it's now kind of taken the reins of original Medicare. So now it's provided by a private health insurance company. And with that, typically is going to come networks. So you're going to have an HMO or a PPO that you have to be a part of. So you got to stay within your networks. If you want to leave, you do need a referral to get a second opinion that is outside of that network. Networks can change from year to year because these Advantage plans, they work in service areas and they group counties. So if at the end of the year, they decide to maybe add a county into the mix, or if they cut one out, if you're part of that county, then it's going to affect you and your plan. Okay. Now, Advantage plans are called optionally renewable every year. So what that means is that they have to renew their agreement every year with Medicare in order to be approved and to still be offered. So yes, they can cancel on. Does that happen a lot? No, not really. Again, we go back to what would happen more would be network changes sometimes. So if you're a part of that county, but they don't necessarily get canceled on a whole lot. All right. Out-of-pocket costs can change over time with Advantage plans. Yeah, so the way that an Advantage plan works is you may or may not have a premium. I'm sure you've all seen the commercials where you have some $0 premium Advantage plans in your area, or you might have some that have a little bit of a premium or maybe a higher premium. Okay, they're kind of all over the board. But an Advantage plan is going to then give you a max out of pocket for the year. Okay. And the way you reach that max out of pocket is based on all the copays that they give you in your outline of coverage. So you're going to have a copay for potentially to see your primary, to see a specialist. If you have an outpatient surgery, if you have a hospitalization, they tell you, they give you that coverage and say, here's what you're going to pay for any particular service. Okay. And that counts towards that max out of pocket. And if you hit it, then the policy picks up the rest of the year. Okay. Now, when it says your out of pocket costs can change over time, that means that if you look at the same plan for the next year, they might adjust, right? They might change the premium. They might change the copays. They might change the max out of pocket, right? They could raise it, lower it, whatever. So you do want to look at that every year and make sure that you know any changes that are happening, because nobody likes surprises in the medical world, right? Now, some of these Advantage plans, they may also include prescription drug coverage. They might include some dental, some vision, some hearing, and maybe some other things that potentially might not be covered with original Medicare and a supplement. Something that's very important to know, if you are looking for Advantage plans, they are all individual. Okay, they all have to be a part of what original Medicare would cover as medically necessary, but the structure of their plan, their outline of coverage, can be whatever they want it to be. So they can all be different. So it's really important to make sure that you know what's being offered. Just because they say they offer dental, vision, hearing, well, it doesn't mean that it's super robust coverage. It could be, but you want to know that they can all be very different. Okay. You cannot pick up a supplement to cover those copays for all the services that an Advantage plan provides. So how does an Advantage plan compare to a supplement? Okay, so I'm actually going to kind of go off the grid here a little bit. And we're just going to run right back down this bullet point list and show you, well, what is a supplement going to do with A and B versus an Advantage plan? Okay, so if you decide to go with a supplement, then A and B, original Medicare, that is your primary. Okay, they are the ones. The analogy I like to use is like a tractor and a trailer approach. So if you go with A and B in a supplement, then A and B is your tractor, and they're the ones leading the way. And your supplement is the trailer, and it can't go anywhere unless the tractor's pulling it along. Okay, so A and B is your primary, and your supplement is your secondary. And what that means is that you really don't have a network outside of wherever Medicare goes. So your supplement will travel all over the country. So you could go to any doctor anywhere, anytime, and you don't need a referral for a second opinion, as long as you are at a Medicare approved facility and as long as Medicare is on board with those services. Then the supplement will be there. They have to. Okay. As we go down the list where it says that an Advantage plan is optionally renewable every year. So again, networks can change, that kind of thing. A supplement, and you can, again, read this in the guidebook that the commissioner puts out, a supplement is actually called guaranteed renewable for life. So what that means is as long as you pay your premium every month, that plan cannot cancel on you. Doesn't matter how much you're costing them in claims, you pay your premium, you're in, and they can't get rid of you. Okay. And your supplement actually auto renews every month you pay your premium. So you don't have to necessarily worry about at the end of the year looking at your plan and having to jump and switch. So when you pick a supplement, you pick a plan, and that plan has an outline of coverage. And that outline of coverage will not change unless you change your plan at some point. Okay. Now numbers change. Right? Premiums, deductibles, all that kind of stuff, those change, but how the plan works with Medicare does not change. Meaning, if Medicare says it's going to cover 80% and your supplement says it'll pick up 20, it will always pick up that 20%. Typically, supplemental plans are not going to cover prescription drugs. That's why you would need a separate drug plan in order to cover any medications that you have. Supplements also aren't going to include dental, typically not vision, hearing, any of those extra things. That is, those are separate standalone plans that we would want to find and get going for you as well. Okay. Now Medicare is individual. Okay, so that's something that we have to get used to. Right now, if you have group insurance, we're used to everybody being under the same plan. It includes your hospitalization, your medical, it includes your drug coverage, and the whole family's on board. But when you go on Medicare, all of that gets pulled out. So everybody's going to have their own A, their own B, their own supplement or Advantage plan or drug plan, whatever direction you decide to go. Okay. And then we got Part D, prescription drug coverage. So currently in the state of Wisconsin, there are 20 different drug plans that are offered in the state. Okay. They are all standalone plans. They have rules that they have to follow. So every plan has to cover at this time a minimum of I believe, 2 medications in every kind of medical category. And that can change every year. So this is one of those things that I can't stress enough how important it is to review your drug plan every year, because there are so many variables involved with this that could affect your pocketbook. Premiums change, deductibles change, how the plans cover every individual med can change, right? So you might have a medication that right now is covered as a tier 1, and next year they might drop it out of their formulary and pick something else up. And you're going to want to know that change. Your med list can change. Pharmacies can change from being preferred in network to standard to being completely out of network. So there's a lot going on there, a lot of moving parts. And if you aren't paying attention to it, that could have a huge impact on your pocketbook. I will tell you, with a lot of the rules and laws that have been coming throughout the years, this next fall coming up here, open enrollment is from October 15th to December 7th. So this is a time frame that I affectionately call drug season. So this is when I review all my clients' drug plans and their lists, and how does their current plan work, and what plans are being offered next year, and how can we save you as much money as possible. Okay. These prescription drug plans, they are only going to be helping out with prescriptions, right? They aren't going to do anything with vitamins or over the counters or anything like that. Okay. So what are your options? Again, we'll kind of go over this again. Is, A and B, again, it's an uncapped liability. So my guess is you probably want to get something that's going to give you a cap. So you can stick with that original Medicare and kind of leave yourself exposed. You could pick up a supplement to go along with it and grab that trailer, okay, and hitch it onto the tractor. You could decide to go with an Advantage plan, okay, and that's fine too. There's something for everybody. If you go the supplemental route, you're probably going to want to pick up a standalone drug plan as well, okay? We'll go back to penalties real quick when we talk about drug plans. Again, if you look at the guidebook put out by the commissioner, the first sentence that they have that talks about drug plans says, enrolling in a drug plan is voluntary. But then the next sentence says, but if you don't enroll in a drug plan during your enrollment period, and then you pick one up later on, you're going to be penalized 1% per month that you delayed enrollment, and that is going to be added on top of your base premium for the rest of your life as long as you have Medicare. So voluntary is a pretty loose term there. You're going to want to pick up a drug plan, okay? So different options meet different needs. Everybody is individual. And it could just be between spouses. One plan might work for one spouse and another for another. It really truly depends on, your medical needs, your financial needs, your prescription meds, right? If you have a list of meds or if you don't have any, that's going to help determine what direction is going to be best for you. Now, there's a lot of options out there, and anybody that is getting ready to turn 65 or has been a part of this Medicare process, that you get stuff all the time. Your mailboxes are busting at the seams with everybody who knows you're getting ready to turn 65, with everybody who's trying to sell you something. And so just be careful, okay? There are a lot of companies out there, a lot of different options. And, if you have somebody tell you that all supplements are the same, well, that's kind of a half truth. In the state of Wisconsin, supplements are standardized. So they all have to start the same, but they're not all the same, meaning companies are different, premiums are different. Do they offer anything outside of what they have to, that base, that entices you to go with them, right? So, and that's something that I would love the opportunity to sift through with you and make sure that we find a plan and a company that fits you and your medical needs and your financial needs. So from here, that's all I have. and take down my information. If you have any questions, I would love to help you out. And, when the time comes, get you set up. So from there, we'll open it up. I did have some questions previously, so I might run down these real quick. So I did have somebody ask if Advantage plans are more beneficial than standard Medicare. It depends. Everybody's favorite answer, right? Again, it's going to come back to you and what your needs are. And sometimes Advantage plans are going to be better for somebody, and sometimes original Medicare and a supplement and a drug plan are going to be better for somebody. So it truly depends on, what you need, what you have going on. How can Medicare A and insurance through employment work together, and which pays what? So we call this like the rule of 20, okay? Meaning, does that employer that is offering the health insurance, do they have less than 20 employees or more than 20 employees? So typically, and I would advise anyone to always check in with your HR department and make sure that you're doing what they're expecting, okay? But more often than not, if you have a smaller employer, then they're going to want you to take out A and B of Medicare, and that will be primary, and then the group insurance will actually fall into secondary position. Now, if you're with a larger employer, then again, more often than not, take out Part A because you've paid into it and you've earned it, okay? But don't take Part B yet, because you're going to have a premium for Part B. And with a larger employer, the group insurance remains primary. And Part A might jump in if you exhaust any sort of hospitalization coverage that you have with your group insurance, okay? But again, you've paid into it and you're entitled to it. So I would say take it, but hold off on Part B and pick that up when the group insurance is going to end, so you aren't paying a premium for something that's going to sit, in the waiting room, okay? I will just throw this one thing in. If you are someone or a household who has an HSA, a health savings account, that's going to throw a whole different wrinkle into the mix. And that's something that we will talk about separately. Okay. But that's something that's important to know and understand. If you have an HSA, then that's something that we need to talk about. Okay. Couple more questions here, and then I'll go into the chat. So do you offer health insurance to those who are not yet Medicare eligible, so pre-Medicare age? I personally don't, but we got somebody here that does that. So Shane is our underage, so to speak, expert. And so he and I are in constant connection. So let's say we have one spouse that is ready for Medicare, but the other one still has a year or two or longer, then we'll bring Shane in and we'll make sure that your options and you're taken care of there. How can I make mid-year plan changes? That's a great question. Okay. So let's go back to your options. Okay. You've got original Medicare with a supplement and a drug plan, or you have a Medicare Advantage plan. Okay. So let's say you go with the world of the supplement. Okay. When you are in your special enrollment period, these are very, very important times. They're important for everybody. They are really important for anybody who has chronic health issues, because during those time frames, nobody can ask you any health questions. You are guaranteed to get in. Okay. So it's really important you have the opportunity to go get the pick of the litter. Okay. So let's say you go the world of the supplement, and you're on that plan for, say, a couple of years, and now you want to go to a different company, and so you go with company A, and now you want to go to company B and choose their supplement. Well, now company B, they're going to ask you health questions. So if you want to make that jump, they're going to health qualify you and determine if they want to accept or deny you. So moving from supplement to supplement is going to be dependent on your health when you're outside of any enrollment period. In the world of Advantage plans, at this time, Advantage plans do not health qualify. So every year you can change Advantage plan to Advantage plan at the end of the year during open enrollment. Okay. Now, what about switching in between them? Well, if you start with the supplement, then you can jump to an Advantage plan. Now, we might have to wait for an enrollment time frame, but you can go to an Advantage plan, no questions asked. But if you start in the world of the Advantage plan, if you want to go to a supplement, if you do it within the first year of being on an Advantage plan, you can do it, no questions asked. But if you've been on an Advantage plan for more than a year, now we're probably going to have to wait for an enrollment time frame, and that supplemental company, they're going to health qualify you and determine if they want to accept or deny you. So movement, again, it goes back to, it depends. Depends on where you are. It depends on your health. Okay. All right. Let me get into these chat questions real quick here. So how frequently or common is it for providers not to accept Medicare assignment rates? It's tough to say. If you go up to like Mayo Clinic in Rochester, I think the last thing I heard, they accept and bill Medicare, but some of the specialists don't all accept assignment. Where I see it a lot more is more with the DME, the durable medical equipment. So if you are someone who, let's say you have a CPAP machine, okay, it's really important that you go to a provider that accepts and bills Medicare, so that Medicare helps pay for your CPAP machines and all of that. Others, it might be kind of specialists here and there. So it's a question that you certainly do want to ask. It's hard to put a percentage on it, but again, one of those questions, make sure you're at a facility that accepts and bills Medicare, and then, does your provider accept assignment? Okay, it's just always good questions to ask wherever you go. Can I email the PowerPoint, the pie chart? You love it. Well, good. I'm glad I simplified things a little bit. Yeah, I'll try to see if I can make a PDF out of this and get things sent out. Okay. Maybe we'll take a list of anybody who's looking for that PowerPoint. Once you leave Medicare A and B, can you be reinstated? Well, I guess it kind of depends on why did you leave A and B. If you left, let's say you started Medicare and then all of a sudden you go back to work and you can get group coverage. Yes, you can pause Medicare, pause B, so you aren't paying that premium, go work, get your group coverage, and then yes, you can come back and pick up B again, and that would be a new special enrollment period. But if you drop Medicare just because, then you're looking at a penalty. So about what percentage of practitioners? So I think we kind of touched on this. There's not really a percentage. It's just a good question to ask. So, are there supplemental plans that also do include dental and/or vision? Not a lot. Typically, what those companies are going to do is they're going to offer. Some might offer you some discounts, or they might offer you a standalone dental and vision plan. That's typically what you're going to find with supplements. If the supplement plan has a deductible, how does that work with Part B? So there's a lot of talk with deductibles and copays and all that, right? A has a deductible, B has a deductible. Now, if your supplemental plan has a deductible, then typically the way it's going to work is you have to hit that, right? So let's say your deductible is $3,000 on your plan, on your supplemental plan. Then the way that's going to work is if you're hospitalized, you're going to be in charge of paying that $1,632, right? That Part A deductible, and it will count towards that $3,000. The Part B annual deductible is $240. So that $240 would count towards that $3,000 typically. So it's just kind of feeding that. Let's see here. my employer's plan will end next March. How do I go about signing up for a plan? Well, Tom, I'd love to help you out and kind of help you get your ducks in a row. So, um, that's what I do, right? Is I help sit down. I'm a former school teacher. So, this is why I like doing webinars and seminars. It's more of an educational approach. I really don't like being a pushy salesman. I want to make sure that people understand the Medicare process as much as possible, right? As much as a Medicare government program allows. So my goal is understanding. I want you to understand Medicare and your options. And then, when you pick your option, whether it's the Advantage Plan world or the supplemental world, then understanding your options within that world. And, that's my job, is to make sure you get it. And I'm not going to force you into one plan or another. I want you to feel comfortable, right? You have to understand it. And whichever direction you want to go, then I would love to help out. Okay. Let's see here. For those of you who have accumulated sick leave because you're a state employee, what is recommended and what can those be used for? Still the same group insurance. So if you are a state employee, and I tell you, all the government things, they're all different, whether you're a federal employee or a county employee or a state employee. So it's all different. And your capabilities are different. So with state employees, if you have this bank of sick leave, or you have all this sick leave that you didn't use, they turn it into a bank of money. And when you retire, you have to pick up A and B of Medicare, and that becomes primary. And then they are going to offer you a handful of options, and your sick leave is going to pay for those options. And I believe that you can't take that sick leave and go get anything else you want. If you want to use your sick leave money, you have to use it for the options that they're providing you, unless they change that, but I doubt they will. So your contact for state employees is really going to be through ETF, because they're the ones that are kind of administering all of that. They have the plans, they know the ins and outs of those plans. So, you have to use your sick leave with the options that they offer. So there's really nothing I can do for you while you're using that sick leave. Now, if your bank of sick leave is ending, they'll let you know that, it's going to end in a handful of months or whatever. Then absolutely, let's talk, because, you could continue paying that premium, but they're typically quite a bit higher than what you can get on the individual market. So when your bank of sick leave runs out, then let's talk. How do I find a comprehensive list of supplements? Well, the choosing a Medigap booklet is a decent resource. You can certainly look at that. Online, you can look at those things, but really, I'm happy to help make it easier for you, and just get you your list, because honestly, you could go to every company's website and now they're going to send you emails and call you and all that. Like, you're on their list as soon as you click into it, and they're all going to be contacting you. So if you want to kind of get away from that and just get the information and not be, constantly pressed, then I'm happy to help out. I am contracted with most of the major players in the supplemental world and the Advantage Plan world. So, I'm certain that I have something for everybody. There's maybe a rare case that I'm not contracted with a company that somebody might really desire to have, but typically not. So, Lori and Doug, you want a copy of the presentation as well? Okay. Same with Carrie. Good. So we'll take everybody down here and make sure that you're on that list. So hopefully we can save this chat and go back through it. Hold on, let me read this quick. Probably save you from having to answer another random question. Thank you for, yeah, absolutely. I'm more than happy to help out. So And how do I get paid for my services? Great question. The companies pay me. I'm paid on commission. There are some agents out there that will pay consult fees. So they charge you just to come in and talk to them. I don't do that. It's a difficult process. It's confusing for a lot of people. So I feel that it's really important to help people understand it. So come in and talk to me. It's my job to get you to like me. I hope you do, and you want to use me and know that I'm in it for, to help you, that I have your best interest in mind. And whatever you choose, I will help get you enrolled, and then that company will pay me. Okay. One last question here. How do you get medical coverage outside of the US? Supplemental plans, they will give you some travel coverage if you want. That's something you can add in for like emergency services. But I would typically say, if you're going to leave for an extended period of time, I would recommend checking out traveler's insurance. If everybody's risk tolerance is a little bit different. So, that's something that I would look into to help you if you end up leaving the country. Okay. So again, thank you so much for everybody coming. Really appreciate it. Again, take down my information, and I would love to help when the time is right. Typically, if you're going on Medicare or you're getting ready, starting about 3 months ahead of time gives us plenty of time to get all your ducks in a row and make sure everything starts. Starting too much earlier than that, there's so much that can change, because sometimes, if a company is changing premiums, we have a presidential election coming up, that could change things. So, 3-4 months ahead of time is plenty of time to start, talking and going through all the different options and, getting your ducks in a row. So again, thank you so much. I appreciate you all being here, and I look forward to talking to each and every one of you and helping you out with the process. Have a great rest of your evening.